Good evening, everyone. It is September 18th, 2019, and I'm excited to meet with you tonight. We're waiting for everybody to kind of jump on and join us, and I think this is a great topic tonight. I am Kaleem Joy. I'm a licensed midwife, a certified pediatric massage therapist, and a certified professional midwife. And I enjoy so much coming and speaking to you live and sharing these topics with you. So I hope you've brought some questions for me tonight as we go through these and be able to explore this topic. We get asked a lot, should we have our children at our birth? And obviously, the birth setting that I practice in is in a home setting. But I think we can explore similar things no matter where a person gives birth. So whether you're planning to give birth, hospital, birth center, or home, I think several of these things will apply and you can kind of adapt them to it. When we think about children being at birth, many times people think, oh, they should never be at birth because birth is too traumatic for them, and that will be something that will leave, an unpleasant experience in their memory. And what we find being at home, and I'll start with that and we'll move on to the hospital setting, is that being at home and having children there, the children, and mind you, their ages have a lot to do with that, right? So children being at births work well. So I'm just going to start out with that. And also say that some of that depends on the birth giver. If the mom, the birth giver, feels really comfortable having her children there and it gives her courage and peace and she wants to have that family environment, the children do very, very well. But we'll talk about some of the things that these children might need and their ages. So first, let's look at the child that may be the 18-month-old. And a lot of times, that's about the pattern that some families have their babies at about 18 months to 2 years when their children are those ages. And these children are just excited about being there. They are, ready for whatever because they have not had the input of society and the TV sitcoms and the news and, other people's opinions and views to, let's say, color them as to whether they should or shouldn't like birth and being a part of it. So as they grow a little bit older and their understanding gets more and people talk about birth around them, the 2 to 3 year old has some understanding, but then as they get to that 3 to 5 year old and then 5 to 8 year old, they begin to understand things because we know that the 5-year-old then begins to understand the difference between fiction and nonfiction. And so their imagination starts working more. And so when people start talking about birth or having babies, their imagination begins to create a picture, an element of what does that mean and how is that going to be. And I think that that's part of the important thing is being able to talk to children about birth and describing it in such a way that helps them to be prepared for it and to be a part of it. Because your children are just as excited, even if they're tiny little ones, at a new baby coming because it's part of your family and they're part of your family. It's not like you're having a child and then this child is this outsider. Because making them an outsider will create often something in those children where they don't understand why they are not being included in this process. And that's why, when we do home birth, some midwives travel out to the family's home. We have a home office, so we do most of our visits here in our office, but the children are here. So they get to know us, we get to know them, they begin to become familiar with the fact that the things that we do, our voices, and knowing that it's kind of a safe space. The enjoyment is when we go to the house at around 37 weeks to make sure that everything is there, all the supplies and all of that. The children are amazed. They're like, wait, you're in our home now. I only see you in the office. What does that mean? So then we're in their home, and midwives who do home visits, the children are used to those midwives being there. So they're part of that tribe, that village, those friends, if you will, of what they know of other people in their adult parental figures' lives. And so they start seeing the supplies getting set up. They also see the parent. The parent is growing and growing and growing, and they're interacting with that belly, and the belly that moves, and the baby who is inside playing with whoever's outside. And the young toddler's age, they just take it in stride. They're like, yeah, okay, whatever. They don't have that outside influence. They're just very innocent, very willing to accept whatever's coming. And as they get a little bit older, they begin to interact with the baby. They begin to understand that a baby's coming as much as they can, and they watch your belly grow, and they watch the blankies getting ready, and the clothes getting ready, and the diapers, and the things that go on that say something's changing in our life. I may not completely understand it, but I understand that such and such had a baby, and I saw that baby, and that must be part of what's going on. And then, of course, as they get older, the 8 to the 10-year-old and the preteens or the teens, they're more aware of what's going on, as well as perhaps how babies, get here when they get into their teenhoods. So the age has a lot to do with it as to how easy they are to have at a birth, and what their ability to prepare mentally and emotionally for it. So when you think about the young child, they need a little bit of tending. They need arms to hold them. If something feels a little overwhelming, those arms to make them feel safe, or to carry them out if they need to be. But one of the things we've said to the support people, or let's say the doulas for the children, right, is we've said to them, love them, feed them, and give them access to their parents whenever they want to, unless the birth giver says, thank you, can you take them out now? Because the birth giver is the one that has to feel completely safe and uninhibited, and an ability to really go forward and have that baby. And if they are too worried about the other sibling, then that isn't going to serve them as well. But I can tell you that's not very often. Most of the time they're pretty comfortable with their children being there. We've had some that they had all their children surrounding the tub that was probably their 6th child, and all of them are around. They're playing in the water. One of them was pouring water over his mom's back and rubbing his back, and he was very young. He was probably 8, 9 years old. And so they can be very supportive. They can come in and put their hands on him and say, Mom, you're doing a good job. Part of that is preparing them ahead of time. And that preparation comes from saying to them, when we have the baby, the midwives are going to come, and Mom's going to work hard. Like when I'm doing the yard work, I dig, or I'm running this, or I'm doing that outside, and I get sweaty and I get kind of hot, and I feel tired sometimes, and it takes me time to be able to get that work done. So having a baby is like good, strong work, and it's very powerful in my body. And so what I need is I need you to tell me I'm doing a good job and that I can do it. And I remember having a sweet family who the first baby had been born by cesarean, and the second baby was being born at home. And this mama was in the tub, and her other child, who was about 3, he just said to her, he put his hand on her head and he says, Mama, you can do this. And it was like the greatest strength to her to feel that her son, who had been born another way, was there telling her that she was strong and that she could do it. And we often will find that it actually gives the birth giver more courage to want to work hard at being able to cope with birth when those children are there. The other thing in preparing them is stories, right? Now, we haven't seen a lot of books on families having babies. There's definitely a lot of books that have been written about the new baby that's coming into the family, but often those are, you see the mom, her belly's getting bigger, and then the mom goes off someplace and brings the baby home. But you don't see the birthing part of it, and so there's not very many books. Excuse me. There is a book called either Welcome with Love or Welcome with Love. And that one is probably the best one that we have seen. The drawings in it are absolutely beautiful. It is a home birth, but you can kind of go through it that way, regardless of whether it's birth center, which it still would apply to, or even a hospital birth. Now, the difference is the hospital is going to have a little more technology going on, and we'll talk about that in a minute. But this is a great book, and like I said, the drawings are beautiful. It talks about, from the child's perspective, of having their family come and having that snuggling with them, and kind of their view of wishing that, they could be near somebody, but we know that there's a lot going on. The noises that mom may make. Now, sometimes women are quite quiet when they're giving birth, until that last little bit when they kind of give what I call the birth song. And the birth song, for some children, you can say, I might roar like a lion, like, "Roar!" I might roar like a lion, or "Roar!" like a bear. And they begin to understand that these sounds might come and that they're okay. But the other thing is that many children, when those sounds get noisy, they put their hands on their ears. They're fine. They're looking, they listen, and the baby's then born, right? So the children do well, and the stories that we hear afterwards are quite sweet and very, very endearing to listen to. I wish that more we had the video when they're talking about things like that, because you can't always get them to replay that story. One of the grandbabies was watching me teach class one night, and I was talking about birth and how the baby comes through the pelvis and pushing and things, and he was probably between 2.5, probably closer to 2.5, and he had been at his siblings' birth probably within about 6 months of that time slot. And so he was staring at me, watching what I'm saying, and then all of a sudden he came up, sat in my lap, and I said, "Do you want to tell them about birth?" And I thought, I don't know what he's going to say. Let's see. And he goes, yeah. He says, "The baby, whoosh. The baby go whoosh." And, his brother was whoosh in the water, and up and out he came, and that was his explanation of it. So remember that their age also has to be appropriate for what they can conceptualize and understand, as well as just understanding that as the age advances, the imagination, what they can work with is there. And yes, many times the difference between the boys and the girls can have some variance as well. Sometimes the young ladies are more apt when they're young to want to be at the births, because that's part of that womanliness, that nurturing, that mama role, and many of them want to be there. Sometimes the boys are like, no. And especially as they get up into preteens, a lot of times they'll go, I don't think I want to do this. And you have to just respect where they want to be at that, and give them that option to be there if they want to, if you're okay with it. Now, sometimes some birth givers are like, I know I won't do well worrying about that child, so I'd rather that they go with whoever the caregiver is, and then they come back as quickly after the baby's born as they can. Great. That works out well too. Baby's in your arms, the cord's still attached. There's a lot of family involvement going on. So there's not an absolute with this, because people will say, well, what's the right answer? The right answer is it has to be what's right for your family, for you as the birth giver, and what's right for that particular child. Now, we do find that children who are included in birth that can then be there to welcome that baby, they do see that it is the birth giver who has given birth to that child, and they tend to be far more supportive of things such as breastfeeding, the time commitments, holding and loving them, and being an integral part of making sure that they do well. So that is one thing that we have seen, is less on that sibling rivalry type thing. And the other thing is, when babies are born, is to help them, the siblings, to have that opportunity to hold them or to get up next to you, explore their little bodies, and feel that acceptance that they also are a part of bonding and welcoming this baby into their lives as well. Because we forget, we always think, oh, the bonding is about the parents. Well, the bonding is about the child too. And we have sometimes said, let's take their shirt off, let's lay a naked baby on them, lay them down in the bed, and let them have that skin to skin as well. So these are some of the things. So books, the sounds, if you pre-look on YouTube, you may find a couple of births that kind of tell that story in a way that you feel comfortable showing them that kind of phase, that intensity, and then the baby coming out. We also find that there's a little bit of a difference between a water birth and a land birth. The water births, there's not as much a clear bird's eye view, if you will, as there is on a land birth. And that all depends on what position a birth giver's in as well. So that's primarily the home, and including the birth center. Now, when you're not at home, you have to pick up children and bring them with you, versus being at home. They can be asleep, or they can be in their natural, habitat, if you will, their toys, their foods, bathrooms, and, they get bored, then they have other things to do. Taking them to a birth center, most of the birth centers have a little family room that has TV, a little bit of toys, but do make sure that, you pack them snacks, an extra set of clothing, some of their things that they may want to do, and understand that they could get bored. Because for them, it depends on the amount of time, and they can get sleepy, and so they may need to sleep as well. Going to a hospital. Going to a hospital is a little bit different because it's a big building. There's a lot of unfamiliar people, and the labor and delivery floor can feel a bit overwhelming. The labor and delivery rooms in the majority of hospitals now are quite large, which is lovely. And most of them have, like this little couch bed that you could lay a child on and sleep and things like that. But there's not much for them to do. So again, being in the waiting room for hours on end, that can be rather trying on them. But having them always have a support slash, special doula, if you will, for them is really helpful. That's there just for them. And helping that person understand that if that child is not feeling appropriate to be in while the birth is going on, the support person may not get to be there, and they need to understand that, because sometimes they can feel disappointed because the child couldn't handle it and now they can't be there. But they need to know that their primary role is to help make sure that the child feels safe and comfortable, and to bring them right back as soon as the baby's born, and allow them to have that space with their family. It's also not to shoo them out and away unless the birth giver feels like that's what they need, because often they're used to them being around, right? Yeah. So hospitals, we also have monitors and sometimes other equipment that's going on. So if you're planning to birth in a hospital, it's a good idea to get online, find some things that you can show them. If you come, Mom, I might have a monitor on my belly and another monitor here, and that's just to help us know what the baby's doing inside, so that we know that the baby stays safe, so that they don't hurt me. They're like a big microphone, and that's all that they are, to listen to the baby's heart, just like we do in our visits. But some of the monitors that go on, when birth happens in the hospital, sometimes there's a lot of people that come in. They're putting on different clothes. They have masks on over their face. The lights are bright. There's a big tray that instruments are on. So, that's a sterile environment, which means the children have to be kept away from it. So they really need to be in arms if they're not old enough to know to stand and keep in their particular zone, if you will. And that can feel like a lot more. So you have to make decisions on when to bring them in and where to put them in the room, because usually down by your legs there are tables and drapes, and you've got your doctor or your nurse midwives and the nurse and the monitors and various things like that. So the best place for everybody is up near mom's shoulders. And if children are up there, their view is a little bit better. They're not maybe watching mom's face, although they're watching whoever the doctor or midwife happens to be. And it's a little bigger of an experience for them when they're there. And if they start falling apart, sometimes they will end up being taken out because it's too much for them. It's too overwhelming. But brought back in as soon as baby is there so that they can see them, touch them, and love them. And some children, you have this beautiful baby in your arms and you're so excited about sharing it with them because now the baby's finally here. They've been waiting, you've been waiting. And you say, do you want to touch them? And they're like, ooh, no. And that's really common for young children to not want to touch a brand new newborn because they're not really sure. They're kind of wet. They've got vernix on them sometimes. Sometimes there's a little bit of blood in their hair. And they're really not quite sure what's going on at that moment in time when they're quite young. And once they get dried off, you're back in bed where they can sit up with you and they can kind of explore at their own pace. Things go, quite well. And that's where we say, as soon as it seems reasonable, is to sit them up in your lap if they're young and put the baby in your arms with them in your lap, which then you kind of both hold the baby at the same time. And they want to, you have to tell them their eyes, we can touch their hands and their feet and their head, but we need to leave their eyes alone. And when they start exploring, that's what they're doing. It's the same way that you as a birth giver or a parent would explore the baby. You want to see feet and toes and their nose and their belly. Oh, they have a belly button, but what's that on their belly button? That looks different. And be able to give them some preparation on the fact that the baby will be fed by the placenta and then they'll have a cord and then it'll dry up. And even if they don't understand all of that, they begin to understand that it's not the first time they've ever seen it or heard it when they get to a delivery. I'm going to be ready for questions soon, so start thinking about the questions that you want to ask. It's also helpful that they understand that there are times when they have to be quiet when you're working hard, and this is most appropriate for some of the children that are old enough to understand that you'll work hard and breathe, and you can even do that with them. You can say, let's breathe. And then we're going to be really quiet for a few minutes, and then we're going to breathe really heavy again. And that's how you as a birth giver also get your preparation, you see, by teaching your children. And remember that birth is normal. Birth is normal, and children should expect it to be normal. Now, here's just a couple of kind of the we don't have a test to prove this type thing, but children do remember their births. And so if you've had a child that's had a birth that maybe was a little, had a lot more story to it, some children, when the next baby is coming, they will cry because there's kind of this remembrance of it, or at least that's my opinion of it and what I've seen. There's a remembrance of something that they need to kind of process through. But what I find is that I feel like they process through it and they heal from it when that next baby comes. And we don't see it at subsequent births. Now, some of that may be that their age gets older. I don't see it in the school-age children as much as I do the younger ones. But again, it's hypothetical, we don't know that for sure. Encouraging them definitely to explore and have that opportunity to be with their new siblings. So if you've got questions, I want you to start firing them off at me as I sort of fill in the gaps here of should we, and here's one of my questions to you. What is the main concern of children being at a birth for most people? whether that's you and your philosophy, or also whether that's other people that you've heard and what their philosophy might be of whether you should have children at birth, because extended family has their own opinions about it, right? And friends, and sometimes the care providers, they have an opinion whether children should or shouldn't be at births. And if you were going through a cesarean, it depends on how much they would know. They're not going to let a child into a C-section room, so that's not going to happen anyway. But there's definitely a different experience if there are some things that happen in the birth that maybe need more support. If a baby needed some support to breathe or something like that. But again, when they're young, remember, they haven't had all this predetermined information. Child fear of unknown or distractions. Yeah. So distractions to you as the birth giver, or that the child will be afraid. And I think that's really a key thing that most people will talk about. I can't wait for my son to be there one day. Yes, because your son has been who you have had, right? They are, if they're your only child, it's like you want to share something with them because they're your only child and you can't imagine not sharing something with them. But your people around you say, you're not going to do that, are you? You're going to traumatize them. That's what they say. All right, let's see. I'm having a home birth, and I think the concern is that she will get upset seeing me and not being totally sure what's happening. She will be 3. Okay, so that is where that preparation comes in, and giving her the benefit of the doubt that, is it your conception of what you might look like to her, or is it really something that she would be afraid of? Now, depending on how she was born, if she was born at home, trust her. If she was born in a difficult birth, then she might have a little bit of that. Okay, let's see, what else? Using too much of my mental energy on my older children during the intense part of birth, or my partner feeling like they need to take care of them over giving me the support I need with him. Yes, and that's where we say you have to be, the birth giver has to be in 100%. And if that's not going to work for you, then your children need to not be there, especially if they're little. Because if you're going to worry about them, that's not going to help. And yes, if someone else is not there to be that support person for them, and your partner is the one that would be expected, you're right, then they are not there for you. And that's why we say they need their extra support people, or maybe they need to not be there. All right, let's see. So back to the 3-year-old, is that she will get upset seeing me. So some of that is identifying, is that your fear that she will get upset, or is that hers? And sometimes we have children that we feel are very, empathetic to us. And, if we have something happen, they fall apart. They may be children that might not do as well. But sometimes having somebody there that may have them outside of that room, but that as soon as the baby's coming or as soon as the baby's there, you feel like you can gather your nest around you, feels good. You, as the birth giver, are the only one that's going to know whether that's what you want. All right, let's see. But yes, I can't imagine her not being there. Exactly. And it's because she grew inside you. And you birthed her and she was here. And all you know about birth is with that child. So when the next child's coming, you think, how can I not have that as part of our family, right? Yes, agreed. Also, that I'll be more worried about her well-being and comfort her and not be able to focus on the birth. Exactly. And you're the only one that knows whether that's going to happen or not. And when that's what's inside you, you have to trust and own that, because as a little story, we had a birth many years ago and there wasn't a support person there for this 18-month-old. And this 18-month-old, when the parents got into the tub, they had this vision that they were going to have this lovely, very zen birth with their family sort of meandering in their tub. Well, this little one was not doing well with this intensity and was just kind of crawling all over mom in the tub, which she needed to birth the baby. And so it was challenging because I had to say to her, I know you want to love her and I know you want her to be okay and you want to soothe and comfort her right now. That's fine, but your body is trying to push your baby out, and I need you to be 100% for the baby that needs to be born, because this child, although she's crying, she is safe and well. Your baby inside needs to be born. So let's focus on her. I pulled the other one out. There were two of us that were there, held that one, and I said to her, I know you want to be with mom. Mom needs to push the baby out. And, she was trying her best to understand. But this is where you have to have that extra support person for these kids. All right, let's see. Ooh, I just love all of your posts here, you guys. Oh gosh, yes, I can imagine she'd probably want to get in the tub with me. Yes, I can tell you, their view of it is like, okay, you're working, you're doing that, that's fine, especially a home birth when you're not necessarily with all the other equipment. They want to splash, they want to throw things in the tub, they want to get in with you because they don't understand the work you're doing, and that's why children, they do fine. They do fine at a birth, but it's really about the birth giver more than anything else. I love your comments. I love them so much. They're awesome. Because it fills in all the things that I may not say, and it comes from those of you who are in either the pregnancy or have birthed recently, and you get to share that with others, and I love that part. So that's the key. Prepare them. The other thing is if you're going to be at home and say, I don't know, maybe they'll be sleeping, maybe they won't. I don't mind having my whoever that is, mother-in-law, mother, friend, sister at the birth, but it depends on, and we always say, tell them, if I need you, will you come and sit with the kids while I give birth? I don't know that they will all want to be in the room, but if they did, would you be okay with that? And that's what you want. And you want to say, how do you feel about me giving birth at home? Because you also want people there that are supporting everything that's going on wherever you're going to give birth, right? Because you don't need anybody in that energy. We had a birth many years ago that there was a doula that was at a birth for this mom, and she had been at her prior birth, which was a cesarean in the hospital. And when she was there, we just said, welcome, we're very glad that you're here. Tell us more about yourself, and how do you feel about being here? And she says, I think that home birth is ridiculous. I do not know why she's doing this. And I thought, oh my goodness, we have got someone who is not on board with home birth being there to support this mom who has chosen to birth at home and has a doula who is not in support. And the birth worked out fine. She had her baby at home. But the next two, she did not have that person there anymore. And you always want to make sure that the people that are going to be there with you are in support of what your plans and desires are. And that includes, if you're going to a hospital and you're planning a natural birth, that they are in support of not trying to rescue you. Because rescuing you is not the solution. The solution is to support you, rub your back, help you get into the shower, tell you you're doing a great job, really encourage you to keep going and do what your body is meant to do, no matter where you're giving birth. And sometimes, I will say, you have to be mindful about who those people are. Sometimes you can have mother-in-laws at your birth, but not your mother. Sometimes the opposite, sometimes both. It just depends, okay? But make sure that people bring something to do, they bring snacks, and they plan on making a meal and tending children. That is their job when they come. All right, more questions. Let's see. Stay away from negative. Yes, indeed. Because it does not support you. And in birth, we always say you have to take that ownership and that empowerment for your birth. You cannot support other people's fears and doubts that are in your space. So therefore, do not have them there. And first babies, sometimes people will say, well, I really want my mother there or my mother-in-law there, but how can I invite her if I don't invite the counterpart? And I'm telling you, that one's a really tough thing, because somebody's feelings are going to get hurt if you invite neither of them. If you invite both of them, then you may not feel comfortable. And you have to go, the one thing I will say is you have to go with what's going to work for you, because you must be the one that is able to surrender, be uninhibited, allow your body to do what it needs to do, and your mind and your body to work together. And anyone else in that space that is interrupting that, you have to not have, or you leave the room and you let them stay out. And that one sometimes is tricky too. And it's very difficult to tell somebody to leave, right? It doesn't matter who they are. It's very difficult to tell somebody to leave unless you really have that kind of relationship with them. More questions. There's one. Let's see. Or here's another comment. I remember my sister thinking I was in so much pain, yes, and needed help, but I felt great. And she kept her mouth quiet because I warned her if she wanted to be there, she better be quiet, right? Yeah. My goddaughter, when she was born, actually a sibling before hers, she had my friend's sister was there, and she was yeah, and I said to her, are you sure you want her here? And she said, yes, she's what keeps my sense of humor. And I thought, all right, it's working for you. You love her. That's what's serving you. Fantastic. But the other thing that happened with her was when she got ready to have a home birth versus a hospital birth, her mother said to her, are you sure you want to do that? Because you were in so much pain. And she had a puzzled look on her face. She says, I wasn't in pain. I was just mad at what was going on. And she went on to have 2 more home births after that and did just a fine job. So yes, people perceive from the outside something that's going on, and you don't want them transferring that to you or to your children. And that's something to have good discussions about before you have children or anybody else at your births. You want them to have the same energy that you want to have there for you, right? Because that's what really helps. All right. Any other comments or questions? I sure love it when you join me in. Sometimes maybe I don't give you a chance, but I'm going to ask you more questions in the future. Is there anything that you did, if you've had children at a birth before, that you felt was something really valuable for them? What did you do in preparing them, or what did you do at the birth that you felt was really valuable for helping your children to have that experience? Put your minds to work for a minute, huh? I know that many families will look for books. They will show the YouTube videos. They will, talk about the stories. They'll also show them pictures of when their siblings or they were born, and that one's lovely. The noises are not there, of course, but as I said, not everybody makes much noise. Some birth givers make a lot of noise because they have to sing their way through birth. And that's the individuality of each of you. And I think that that's an important element to remember too, right? All right. Any comments about what you did to prepare your kids? For those of you that may have had children there. Whoop, go down. There we go. All right. Well, I think we've had a really fun idea and discussion about having kids at birth. That's been my experience. And I hope for you, if you're pregnant or planning another pregnancy, that you really seriously consider having your children there, because it does make a good impact on them. They feel really included, and especially that there's not just all of a sudden this baby that now is taking all your time and your attention. They know that baby came out of you, and they are looking to you and saying, the baby's crying, feed the baby, pick the baby up. They're usually on you pretty good about it. So I'm looking forward to seeing all of you next week on Wednesday at 7 o'clock. I hope you'll invite some friends to come and join us, and just keep that enthusiasm and bring those questions. And I just want to say how grateful I am for all of you, and that you come, you join, and you participate. It makes it worthwhile for me. And remember that on Facebook, this gets saved. So if you ever want them to go back and watch it, please send it along and tell them, go to Natural Childbirth 101 and watch the one about children at birth, or watch the one about midwife consult, or watch the one about breastfeeding, whatever it happens to be. Oh, I've got a few more comments. Fantastic. Let's feed them off. I got my boys a baby doll they could feed, burp, hold while mommy held their brother. Oh, I love that. I just joined, so maybe missed it, but do you think sibling doulas are a good idea, or maybe more distraction? I think it's really good to have somebody there. We were talking about the fact that to have a support person or a sibling doula is really good for them. Oh, one other thing I thought about is that when your siblings are they're a little bit older, tell them that it's going to be a time for them to plan the celebration, the birthday party for the baby. But it may take time, and plan activities like, making an art project, making cupcakes and frosting them, and making a meal. And it gives them purpose while they're waiting for this baby to be born. And then when the baby comes, you can bring in that this is a happy birthday day, and it kind of brings that story about how this baby came to be part of your family. And played newborn crying soundtracks. Oh, Danielle, that's brilliant, on YouTube, so they could hear what new babies sound like. I never thought about that. What a brilliant idea. You're so smart. You're so smart. I love the doll idea. Here's another thing that we have said to families is to get the doll, and to have a doll for you, and say, oh, well, let's pretend the baby's here. And you sit down and you nurse the baby, the pretend baby doll, right? And do it for like 2 minutes. And when they do, and they have to sit, say, oh, I can't come get that for you, I'm nursing the baby. And then when the baby's all done, then say, oh, and then I'll come get it for you. And escalate that to like a 5 or a 10-minute time period. And what it does is it lets you sit down. It tells the other children that you're going to sit down and feed the baby for a period of time, and what that's like. I love the crying sounds there, Danielle. And letting them watch, nursing videos even. And be able to then have a doll really is helpful, so that they have somebody they can cuddle and love, and be able to have their baby that they can go through their pretending with, so that you're not the only one that got somebody new to cuddle. That's so brilliant. Excellent, excellent, excellent. Let's see. Here's a couple more. My boys sing happy birthday to their new brother was one of my favorite memories from his birth. Aw, and love the cupcake idea. Well, thanks. It's not original. That's one thing I will tell you. You can see YouTube videos from time to time where it's usually a video that they go, they walk in the door, and then you see the birth kind of happening, and the family's in the kitchen doing their thing. But yes, I just think that when you begin to feel like your family is celebrating, and it's very exquisitely remembered, because birth, by what you eat, what you smell, everything around there imprints on your mind very clearly, and because those experiences are so exquisite in you. Now, you may forget some of the intensity, which is why you'll do it again, right? But there's a real exquisite memory that happens from going through those experiences, and seeing the delight on your children's faces. And like I said, some of them need a little bit more time to get used to their sibling, and that's fine. It might be an hour, it might be a day, and then all of a sudden they'll say, me hold. Sometimes you barely gotten the baby out and they're like, me hold, me hold, me hold, me hold. And you're like, okay, wait just a minute until I can get to that point, because they're so excited about it, because they've been walking through the pregnancy with you the whole time. Right, thank goodness we forgot the intensity. Well, nature does have a way of making sure that you remember all the good and embrace the fact that the baby's there and the reward is there, and remembering that birth is a powerful experience, and sometimes that power can take you beyond what you thought you could do, right? And that intensity can be so huge that you give everything that you can, and you just think, wow, I didn't think I could do that, but you do. And you go back to have more, because that's what happens, because you love your children so much that you are willing to go through whatever it's going to take to get them into your arms. And the more that you believe in yourself, the more you let go, the more you trust in that, the better the possibilities that that birth will bring you what you hope for, right? All right. Thank you so much for joining me tonight. I have enjoyed all of it, and thank you for your comments. They're just so fun, because I feel like I get to have you right here with me. So remember, go in, hug your children, and tell them that you love them. Tell them that they are amazing and that they can do anything that they set their minds to. I will see you next week. Have an amazing week. Here in Sacramento, we have some cool weather, and we hope to enjoy it well. Take care. Bye for now.